Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us. It's the 10th anniversary of our Health Matters show and the 45th anniversary of our enrollment period, which begins October 15th. Before we begin, I'd like to thank our sponsors, our Altman Health System, Studio Arts and Glass, and Genuine Appraisals and Liquidations. Today, Brad and I are broadcasting from our administrative offices, and our very special guest is Mike Novelli, Sales and Client Retention Specialist with Aultcare. Good morning, Mike, and welcome to the show.
Good morning, Paul. Thanks for having me.
If you're 65 or older, you've been receiving lots of calls, letters, and emails regarding Medicare Open Enrollment period from October 15th through December 7th. What you may not know is nationally, roughly 70% of Medicare patients do not review their plan during open enrollment period. And that can be scary and leave an opportunity to discover unwelcome or unwanted changes in coverage when they visit the doctor, pharmacy, or another provider in the new plan year. Another fun fact is Medicare Advantage plans have become the way that most Medicare patients are receiving their Medicare benefits. In August of 2022, 48% of Medicare beneficiaries chose to enroll in a Medicare Advantage plan. Advantage plans have become popular because they offer more benefits that are not covered by traditional Medicare. This morning, we're fortunate to talk with Mike Novelli from our local 5-star Advantage Plan Primetime Health Plan. Primetime is locally owned, and when you call, you'll be talking to a neighbor or friend to help you understand your Medicare benefits and options. We'd like to remind our listeners today that our program is available on our podcast. You can download that on your favorite app. Just look for Health Matters with the Medicine Center Pharmacy, and please subscribe.
So, Mike, welcome back to the show. Please tell us a little bit about yourself and introduce yourself to our listeners.
Sure, Paul. I have been in the Medicare space for over 10 years, but I've been in the health insurance for going on my 4th decade. So I have a little bit of experience. Brad mentioned about local. I was born at Altman Hospital. I tell people I haven't gone very far in life. I'm sitting at Altman Hospital right now. So that's just a little bit about me. And I appreciate the kind words at the onset about our 5-star plan.
So during this time of year, we hear a lot about AEP, and it isn't a reference to our electric utility. What is AEP when it comes to Medicare plans?
Sure. AEP is an acronym for the annual election period for Medicare Advantage and prescription drug plans, also known as PDPs. During this time, a Medicare recipient may change their health insurance plans for a January 1 effective date. The dates of AEP always start on October 15th and always end on December 7th.
Pearl Harbor Day, huh? Isn't that right?
Yeah, that's Pearl Harbor Day. I don't know why they tied annual election period to Pearl Harbor Day. Pretty interesting.
Yeah, for sure. So what type of beneficiaries what type of changes do beneficiaries offer or make during AEP?
Sure. During AEP, beneficiaries have the option to join, leave, or make changes to their Medicare Advantage and prescription drug plans. That is why it's important to review the annual notice of change that beneficiaries receive from their current insurance company. Brad mentioned, that people don't necessarily review the changes, and it is so important that when they receive that document in the mail, they look at what changes are happening so that they don't walk into the medicine center pharmacy in January and say, why isn't this prescription $5 instead of $10? So it's very important that people review those changes. And then as they shop for a new plan, they can compare what the benefits are going to be next year versus what they have this year.
So what happens if someone would miss the time frame to change during AEP?
Well, if they miss that time frame, they do have an opportunity from January 1st through March 31st of every year to make a change. During this time, beneficiaries can switch to another Medicare Advantage plan with or without prescription drug coverage. They can disenroll from their current plan and obtain coverage through original Medicare. And then if they do that, they also have to purchase a Part D prescription drug plan separately. If you're on a Medicare supplement plan and you unfortunately miss the open enrollment deadline of 12/7, you'll have to wait until the following year to make a change to an Advantage plan unless you have a qualifying event, because the open the open enrollment period only applies to Medicare Advantage plan recipients.
Okay, so what if I'm happy with my current coverage? Do I need to do anything?
Well, as long as you've reviewed the changes for the coming year and you're satisfied with what those changes are, you don't have to do anything. You'll roll over into the same coverage you have, and then you must act and enroll into another plan if they no longer offer the current plan that you're on. So basically, if you're happy, you can sit back and do nothing and ignore all those flyers you get in the mail from your current insurance company or prospective insurance companies.
But isn't it likely that okay, so let's say I have a plan, okay, I'm in and I'm just going to continue in that same plan. But isn't it likely that that plan probably made some changes?
Absolutely.
Okay.
Every plan makes changes. Now, we have been in a good cycle lately on Medicare Advantage plans, where plans typically are improving the coverage. So, for instance, dental and vision benefits have increased for most plans over the years. So, while there are changes, they normally are changes that are positive, but at the same time, and you know this well, that formularies, and we're going to talk about that later on in the program, but prescription drugs, I think, are the most volatile piece
Yeah.
of a Medicare Advantage plan, and something that beneficiaries have to be familiar with and review so that they make sure they don't have any surprises when the coming year arrives.
Okay.
Do you have anything else that you feel it's important to review with plan options, Mike, when people are looking at a plan on a year-to-year basis?
Well, I think that the out-of-pocket, the annual out-of-pocket, it's important to review that because those do sometimes go up. The plan premiums may change. Co-pays at your doctor may change. So those things that you most commonly use with your health benefits, I think those are the things really you should focus on, whether it's how much your prescription drugs are going to cost, how much you're going to pay when you go to your primary care physician, how much your out of pocket is going to be on an annual basis. Those are the critical things that you need to review when you're looking at your plan for next year.
So I know there's many different types of Medicare plans out there. Can you explain the difference between a Medicare supplement plan versus a Medicare Advantage plan?
Sure. A Medicare supplement plan is something that supplements original Medicare. So beneficiaries have to have Medicare Part A, which covers hospital benefits, and Medicare Part B, which covers doctor and outpatient services. So those two plans coupled together, those Part A and Part B, are what is referred to original Medicare. When you have original Medicare, there are lots of out of pockets. There's a deductible when you go into the hospital. There's an annual deductible when you go to your doctor. So people typically would buy something called a Medicare supplement, which supplements original Medicare. So those two pieces coupled together provide coverage for doctors and hospitals. But if you have a Medicare supplement, you also have to purchase something called a standalone prescription drug plan from a private insurance company, because original Medicare and Medicare supplements do not provide prescription drug coverage.
Hmm.
So in a Medicare Advantage plan, we wrap the benefits of Part A and Part B and also Part D drug coverage into one plan typically. And I need to say that you can purchase a Medicare Advantage plan without prescription drug coverage, but typically most Medicare Advantage plans cover prescription drugs. So you have one card that gives you all the benefits when you have a Medicare Advantage plan. When you have original Medicare and a Medicare supplement, you have to carry your original Medicare card, you have to have your Medicare supplement card, and then you also have to have your Part D plan and know when to use those. So that's the main difference.
I get questions many times. What's A? Why do I have to have A? Every Medicare beneficiary is on Part A. Is that correct?
That is correct. Medicare Part A is free if you have worked basically 10 years and paid into Social Security for 10 years. Medicare Part A is free.
Okay.
And that covers hospital benefits, inpatient hospital benefits primarily. It also covers some hospice benefits and a few other benefits. Part B covers doctors and outpatient visits, labs, x-rays, those kinds of things. And Part B is not free. You have to pay a monthly premium to have Medicare Part B. In 2022, the Medicare Part B premium is $170.10 a month. The good news is Medicare Part B premium is going down to $164.90. Now, importantly, if I didn't say this earlier, whether you have a supplement plan or a Medicare Advantage plan, you must have Part B. So most retirees, most Medicare beneficiaries do opt into Part B and get that coverage and pay that premium on a monthly basis. In addition, when you're on a supplement and you have Part B, you have a deductible, an annual deductible before Medicare starts paying. You have a deductible. And that deductible in 2022 is $233 annually. Another piece of good news is the Part B deductible is going down from $233 annually to $226. So Medicare recipients are going to see a drop in that deductible as well.
Jeez. Okay. Okay, Mike, our first break's here. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. Don't forget to stop in for your flu shot or COVID booster. Walk-ins are welcome, or appointments can be made at our website, medshoprx.com. We're talking this morning with Mike Novelli, Sales and Client Retention Specialist with Aultcare.
Okay, Mike, you mentioned several advantages of having an Advantage plan over original Medicare Part A and B. Is there anything else you want to mention for advantages besides carrying around 3 different cards and having to know how 3 different plans work?
Sure, Brad. Medicare Advantage plans also offer additional benefits that original Medicare does not offer. For example, Medicare Advantage plans offer additional dental and vision benefits, gym memberships, meals after inpatient observation stays, and most importantly, an out-of-pocket max. So annually, when you have just Medicare Part A and B, as I mentioned, there are no limits to your out-of-pocket maximums. And the co-pays for hospitalizations can become quite significant if you're in the hospital for any length of time. When you have a Medicare Advantage plan, you have an annual limit to the maximum amount that you can pay. Many plans offer 0 premiums, so you don't even have to pay a premium, and they also offer drug coverage with that 0 premium. Maybe you never had a Part D plan and you find out at an age 70 when you need prescriptions that you're going to be subject to a penalty. You might choose not to buy a Part D plan because of that penalty, but you can still buy a medical only Medicare Advantage plan, as I mentioned earlier, and then you can avoid paying that penalty.
Okay, are there any
Interesting.
disadvantages of having an Advantage plan over original Medicare A and B?
Well, I think that the biggest disadvantage to having a Medicare Advantage plan is typically you have a network of doctors, whether it's an HMO, which is a health maintenance organization, and you have to use the doctors in the network, or you're in a PPO, which is a preferred provider organization. Typically, to maximize your benefits in a Medicare Advantage plan, you have to go to the doctors and hospitals in your network. Now, I think that the world has changed a lot because all of us under age 65 that have medical coverage have gotten pretty used to having to go to doctors and hospitals that are in our network. So I don't think it's as big a disadvantage as it was maybe 20 years ago when people weren't used to having to go to a particular doctor or a particular hospital. But importantly, when you buy a Medicare Advantage plan, you should check the doctors and hospitals in that network to make sure that you are covered. Now, for Primetime, we have an extensive network offering access to over 50 hospitals, including Altman, all Cleveland Clinic facilities, including Mercy and Canton, as well as university hospitals in Cleveland. So we do have an extensive network.
Interesting.
So what happens by chance if the doctor I want to see isn't in the network of the Advantage plan?
Well, those rules are dictated by the Advantage plan. There are HMOs and PPOs, as I mentioned earlier. Health maintenance organizations are much stricter on your access to doctors and hospitals outside the network. Preferred provider organizations typically have in-network benefits and out-of-network benefits. If you go out of network in a PPO, you'll pay more money for the benefits. So it is important, as I just mentioned, to know if your doctor is in the network. In some cases, you may go to an out-of-network provider, and this would require a prior authorization. However, you may be denied if that service is available in the network. And I always like to use an example. If you're going to have an appendectomy, you're not going to be able to go to an out-of-network doctor and get that appendectomy. But if you're having heart surgery or some significant treatment, a transplant, and you need a referral to a specialized facility, typically those are the kinds of things that generate an approved referral.
So what happens if I'm on an Advantage plan and I go on vacation?
Well, this is a misconception that many people have about Primetime and Medicare Advantage in general. We have coverage, worldwide coverage for emergency and urgent care. There is a copay associated with that visit, but we do have coverage if you're traveling and out of our network.
Interesting. Gosh, that's amazing. It really is. What if I have to go to the hospital while out of network? Is that covered? Like
That's
an
a great
emergency or something?
Yeah, that's a great question, Paul. And if you need surgery or inpatient care to sustain your life, you'll be covered as though you are in network. And I use this example. Let's say you're down in Florida, you're a senior, and you're having chest pains. You go into the hospital and you have to have open heart surgery. Okay. That open heart surgery, the hospital, the doctor, everything associated with that would be covered as if you walked into Altman Hospital and had that same service. So we're going to provide emergency services to sustain your life wherever you seek that care when it happens.
Amazing. Okay. If I join an Advantage plan and don't like it, am I stuck in it forever?
No, you're not stuck in it forever. Again, you have the opportunity during each year during the open enrollment period from October 15th to December 7th. You have the option to change Advantage plans or go back to original Medicare A and B. And again, I always like to stress, remember, if you would leave an Advantage plan and go back to original Medicare, you also need to buy a Part D plan if you want prescription drug coverage. There is also something called an open enrollment period from January 1 of the following year. So next year, 2023, from January 1 to March 31st, if you're on an Advantage plan and you want to make a one-time switch to another Advantage plan or go back to original Medicare, you can do so during that time frame.
We may have already answered this question, but can you explain prescription coverage or Part D coverage?
Okay, so, just giving a little history lesson, original Medicare was passed during the Johnson administration in 1965, and it provided coverage for hospitals and doctors and never provided coverage for prescriptions. In 1997, the
Bush.
government passed
Yeah.
Part D legislation that provided drug coverage for seniors. It is separate from A and B. They call this the alphabet soup, Part A, Part B, Medicare Advantage is Part C, and Medicare Part D for drugs was passed, as I said, in 1997. And as it rolled out in two forms. It could be part of a Medicare Advantage plan at no additional cost. But again, if you have original Medicare, you would have to buy a standalone Part D plan that, again, most insurers offer.
Okay, it's time for the news, Mike. It is the bottom of the hour. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to the show. We are talking this morning with Mike Novelli, Client Retention Specialist with Aultcare. We have a lot more to cover this morning, so let's get back to the show. I think you're up, Brad.
Okay. Hey, Mike, did you get to talk about everything you wanted to for Part D coverage, Mike, or do you have anything to add after your wonderful history lesson?
I think that's about it, Brad.
Okay. Very good. All right. Let's talk about the F word, and I don't mean the bad word, but sometimes it's a bad word. Let's talk about a formulary, what it means to a patient, and what it means to find your medication on a formulary.
Great question. We talked in the beginning about the importance of looking at changes that are happening to your Medicare Advantage plan when you get your annual notice of change. And I think the most important thing for seniors to do is to look at the formulary of the plan they're on and make sure that the drugs they take are covered on that formulary and make sure they haven't changed. Typically, a Medicare Advantage plan will have 5 or 6 tiers of medications. Tiers 1 and 2 are typically generic drugs. Tiers 3 and 4 are typically brand name drugs. Tier 5 are usually specialty medications. And then some plans have rolled out a tier 6 that usually contains drugs that are, again, with no copay, but they're usually preventive medications, like vaccines and those kinds of things. So at Primetime, we have 5 tiers of medications. And tier 1 is for preferred generics. Tier 2 is for other generics. Then we have in tier 3 preferred brand. Tier 4 is non-preferred. And as I mentioned, then tier 5 is specialty meds. Now, why that's important, and I'll just use an example of a blood pressure medication. You guys can speak more to it than me, but there are literally dozens of medications to treat blood pressure. So if you're on a particular blood pressure medication, you may find that on your current plan, it's a tier 1 generic drug. And on a plan you might be looking at as a competitor, it might be in tier 2 and it might cost you $5 or $10 versus 0 as a
Hmm.
tier 1 medication. So every year you need to get all the drugs that you're taking and identify what tier they're on your current plan, and what tier copay is associated with that, so that you know on a regular basis when you walk into the medicine center to get your refill that you're going to pay $0 for your tier 1 medications, maybe $6 for tier 2, but you'll know before you go to the pharmacy what you're going to have to pay. If you don't check it out, you're going to have some surprises when you walk in January 1. They could have moved a drug completely off the formulary and you will have to go to your doctor and change prescriptions, or it may cost you more money. So it's really important for seniors to look at that and see what those are. And like at Primetime, you can go on our website and identify where our formulary is listed. You can also call our customer service department and speak to a local representative to find out if your drugs are still in the network. And you can talk to our folks and we'll tell you exactly what the copays are going to be in 2023.
Wow. And Mike, can they change the formulary drugs if you renew to a new Part D program? Can they change the drugs during that program time?
Typically, no, they cannot change during the year, the plan year that would start January 1, 2023 and go through December 31. The only time they can change that formulary is during open enrollment. Now, if a new drug comes on the market, they may add a drug, but they're not going to change what tier a current drug that is on the formulary during the year.
Yeah. I recall in the early days of Part D that there was some plans that were in fact changing during the course of the new renewal, shall we say. Is that against the law, or changing the drugs in a D program, or what?
Yeah, I'm I'm not familiar with that happening, Paul, but the way it's structured, we have to submit our formulary with our bid. Every year we have to turn in what's called a bid to CMS, and we do that in June, and we tell Centers for Medicaid and Medicare exactly what our benefits are going to be for the 2023 plan year. They review that bid submission, they approve it, and then we're locked into what we said we were going to cover tier by tier on the pharmacy benefits, and also how we're going to cover hospital and physician benefits during the course of that year. So I don't believe that you'll see those kinds of changes during the year. The only thing I can see changing is if a new drug comes on and we add it to the formulary.
Okay.
So let's talk about another bad word for patients sometimes. Let's talk about the donut hole, what it is, and how it relates to Medicare Part D coverage.
Yes, the dreaded donut hole. Well, the way that the benefits are defined and provided in Medicare is that when you're in the initial coverage period, you may have a deductible for brand name drugs. And once you get through the deductible, you'll have copays associated with your prescription drugs. If you're taking expensive drugs in 2023, you could reach the donut hole, which is a total of $4,660. Now, the thing that many Part D people don't realize is that $4,660 is made up of both what the member pays at the pharmacy plus what the plan pays at the pharmacy. So if you're taking a drug that is $500 a month in cost and your copay is $45, the total cost of $500 goes towards the donut hole. Medicare Advantage plans are required to send an explanation of benefits monthly to members that track their progress towards the donut hole, so that you can see on a monthly basis, are you approaching the donut hole? Because once you reach the donut hole, then your coverage changes and you have to pay 25% of the negotiated price of drugs in the donut hole. So it can get expensive, and it can be a financial hardship on folks when they reach the donut hole. If I can throw out a piece of good news, and I don't have enough information at this time to talk about, but folks may recall the passage of the Inflation Reduction Act this past August by the federal government. Contained in that legislation is in 2025, members will have a limit of $2,000 in annual out-of-pocket expenses for prescription drugs. Now, they haven't released the rules on how that's going to affect seniors, but that is an exciting change for seniors and the hardship of expensive drugs. So that's an exciting change that happened with the Biden administration getting that Inflation Reduction Act passed.
Amazing. Just amazing.
Is there anything that members can do to avoid, or can they buy extra coverage to get themselves through the donut hole?
Well, typically, unless a member has Veterans Administration coverage or extra helps through Social Security as a result of a low income subsidy or on Medicare, there aren't a lot of options for people in the donut hole other than getting generic drugs if they're available for a particular medication that you're taking, because generic drugs, if you take them, they're always less expensive than brand name drugs. But for those specialty meds and brand name drugs that seniors are taking, they're destined to go into that donut hole probably. And that's why the change in 2025 to this max out of pocket of $2,000 will be so exciting for seniors who are suffering that hardship of expensive drugs.
Incredible.
Okay,
So,
break time.
oh yeah, that's soon, huh?
Boy, it's going fast.
I know, it really is. Okay, Mike, you're telling us a lot. All right, so our final break is here. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. I am your pharmacist, Paul White. Thanks for joining us this morning. Let's get back to the last segment of the show.
Okay, Mike, to make this all a little more relatable, can you give some examples of what coverage is like on Medicare, original Medicare versus Primetime Health Plans, HMO, POS?
I sure can. And the first thing you need to keep in mind is original Medicare has deductibles in coinsurance that recipients are responsible for. There's no out-of-pocket max, as I mentioned earlier, under original Medicare. So the charges you incur, you'll pay a percentage with no limit. When it comes to Medicare Advantage plans, you have a max out-of-pocket where each of your co-pays or coinsurance that the member is responsible for medical services applies towards their max out-of-pocket. Once you have met your out-of-pocket, you're covered 100% for the remainder of the year. Usually, MA plans, Medicare Advantage plans, have a set copay for each service. Here are some examples. Inpatient hospital on original Medicare, the patient must pay up to the deductible first before coverage is 100%. The Part A deductible is $1,556, whether you are in the hospital for 1 day or 60 days. Then days 1 through 60, the patient would also be responsible for a copay of $389 per day. And for what's called lifetime reserve days, which would be days 91 through 150, the patient would be responsible for $778 per day. So you can see that if you
Sheesh.
have a significant inpatient confinement under original Medicare, the copays and deductibles could be crippling.
Mhm.
Under our zero premium plan at Primetime, the ultimate plan, the responsibility to the member would be a copay of $310 per day for days 1 through 6. Once they reach that 6th day, which the total would be $1,860, the member would not be responsible for any additional costs in the hospital under that $1,860 copay. So if they were in for 60 days, they would pay $1,860. And oh,
Jeez.
by the way, in the hospital, if anybody's been there, you know, you get bills from doctors and you get bills from the
Yeah.
hospital, and every charge that's incurred in the hospital, whether it's a doctor or hospital charge, while you're in that hospital is included in that per day copay of $310. And also that $1,860 on our Medicare Advantage Ultimate Plan goes
Hmm.
towards our $4,300 annual out-of-pocket max. So you can see that if you had 2 or 3 inpatient stays in the course of a year under our ultimate plan, the max you could pay is $4,300. And then if you reach that max, you don't have any copays for physician visits, hospital visits for the rest of the year.
Hmm.
Here's another example. Lab work on original Medicare falls under Part B services. When
Mm.
it comes to Part B, the 2022 annual deductible is $233. And as I mentioned, the 2023 deductible is going down to $226. If there is charge for $150, the member would pay $150 until their Part B deductible is met. And then once the deductible is met, the enrollee would pay 20% of the cost. So again, in this example, if there was a charge of $150 3 or 4 times, once you reach that deductible, you're still going to be responsible for 20% of that $150 or $30 every time. Keep in mind that all Part B services, once the deductible is met, then the recipient is required to continue to pay that 20%.
Gosh.
Lab work on the Primetime Health Plan, Ultimate Plan, the enrollee would pay a copay of $35, which would also apply towards their out-of-pocket max. So you can see there are real benefits to having a Medicare Advantage plan versus original Medicare.
Wow. That's amazing. So what are some other benefits on Primetime Health Plan HMO-POS that you don't get with original Medicare?
Okay, so let me stop for a second and explain what POS means in that HMO. I mentioned earlier that we are an HMO POS. HMO means that you're limited to go to the doctors and hospitals in our network, which I've already told you, we have an extensive network, including the Cleveland Clinic. The POS stands for point of service. And again, this is a government designation. And what that means is that certain benefits, you can go to any doctor or for those benefits that fall under the POS designation. And for Primetime, it's basically lab work. You can go to any lab and it's covered as if you were in our HMO. And also on our dental benefits, which I'm going to talk about in a second, you can go to any dentist. Many of our competitors require you to use their dental network, and they have limited dental network. And so that is a big difference. With our zero premium plan, getting back to your question, what are some of the things that we have that aren't on original Medicare? Well, you would receive on our zero premium plan a $550 annual allowance towards dental. So if you go and you get a cleaning, if you have to have a filling, you have up to $550 of dental coverage, which original Medicare does not cover. Also, We have a zero copay for a routine eye exam. So you're going to go and get your eyes tested. You get a new prescription. That's going to cost you zero on our ultimate plan. And in addition, we provide a $300 annual eyewear allowance. So you could get a pair of glasses and you could get your visit to the doctor for free. And it is not covered under original Medicare that way. We also offer no-cost gym memberships through Silver and Fit. Many of the gyms in the area are in our Silver and Fit. The Ys are in. There's just many that you can find out about, but that is covered with no gym membership. We include a Part D plan with $0 copay for many Tier 1 generics using preferred or mail order pharmacies. And just a reminder, original Medicare doesn't cover Part D benefits. You have to go and buy a standalone Part D. We have our insulin program where many insulins are covered at $35 copay max for a 30-day supply. We provide meal delivery for up to 10 meals after you have an inpatient or observation stay. There's an allowance on our zero premium plan of $200 a year paid out quarterly at $50 for over-the-counter items. You can get toothpaste, you can get dental floss, you can get a myriad of things through our mail order program that provide you $50 worth of benefits a year. Something new that we've added this year is Papa Pals. This is a companion service where if you need someone to come into your house because you're limited mobility, maybe after knee replacement surgery or hip replacement, you also have those kinds of benefits available. And keep in mind that Primetime Health Plan is an HMO POS with a Medicare contract. The last thing I want to say on this is, and you mentioned it at the onset of the program, we are a 5-star plan. What does that mean to our members? That means that based on CMS's review of how we deliver our services to our members, they're receiving best-in-class care and the customer service is best in class. And we just think we have a lot to offer our community as a Medicare Advantage plan.
Interesting.
Hey, Mike, we're running close on time. How does a listener today tuning in sign up for Primetime Health Plan?
Sure. Great question. Thanks for that, Brad. For more information, they can contact Primetime Health Plan at 330-363-7407, 800-577-5084. TTY users can call 711 for more information. Our call center is open Monday through Friday, 8 a.m. to 8 p.m. From October 1 through March 31st, the call center is open 7 days a week from 8 a.m. to 8 p.m. You can also visit primetimehealthplan.com and request a brochure. And we are open for walk-ins or schedule an appointment from Monday through Friday, 8 a.m. to 4:30. And again, a reminder, Paul, you mentioned this, when you call us, you're speaking to someone who works in Canton, Ohio, lives in Canton, Ohio, and is here to help you. When you walk into our office for help, you're going to meet one of our friendly salespeople who will help you make these decisions you need to protect yourself as you age.
Super. Super. Okay, Mike, thank you very much for being our guest today. You told us a lot. Michael Novelli, Sales and Client Retention Specialist at Aultcare. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsors, Altman Health System, Studio Arts and Glass, and Genier Appraisals and Liquidation.